Hi, my name's Manoj Krishna, and I'm going to tell you a story about a young man who's had 14 years of back pain prior to his treatment. His MRI scan shows that he's got an isolated degenerative disc at the L4-5 level, and he has symptoms of clinical instability. The back gives way on a regular basis. We did a less invasive posterior lumbar interbody fusion for him at L4-5. The surgery takes about 75 minutes. Here's Damien in his own words. Morning, Damien.
Morning.
Okay. Start by telling me how old you are, sir.
I'm 40-year-old now.
40. Okay. And tell me a story about your back problem and how it started.
It started about 14 years ago. I was a servant soldier. I damaged my knee and it took a long time to heal, so I compensated it by walking differently, and eventually it damaged my spine slightly. I suffered with it on and off for 14 years. Then I came to see yourself.
Tell me about what problems you had with your back over the 14 years.
Every couple of months throughout the year I'd get seizures and I'd be all twisted and bent out of shape, and I'd be really uncomfortable and movement was difficult. But after a couple of weeks of medication, the tramadol and the diclofenac, etc., it eased off, and then I could go back to work, and I just lived with that.
What sort of work do you do?
At the moment I'm an engineer now, electrical engineer.
All right. And you've had plenty of physiotherapy and all that over the years.
Over the years, yeah, I've paid for physio lots of times out of my own pocket. I've had private physiotherapy, and it helps at the time, but it didn't relieve the problem.
Now, I was just thinking, we wouldn't live with a toothache for more than a week, before going to the dentist. What made you wait that long before coming to see me or looking for help?
Because it was only happening a couple of times a year, it wasn't that much of an impact for me. But over the last 2 or 3 years, it's been happening more and more regularly, and it's been more and more intense. The time I had just before Christmas, I was having constant spasms for over an hour, just seizure after seizure after seizure, and it was just too unbearable. In the end, I just had to get it done.
All right. So 2 weeks ago, we operated, and you had a interbody fusion or a PLIF at L4-5, which is a second disc from the bottom. Please talk me through your experience of surgery and when you came in and so on.
The entire hospital experience was amazing, and I can't praise the hospital staff enough. The level of care is outstanding. I had the operation on the Monday morning. On the Tuesday, they had me up and about walking. It was a bit uncomfortable in the morning at first, but by tea time, I couldn't. The pain had decreased by a good 50% by tea time. The following day, I was discharged, and I've been doing walking and 2 or 3 hours walking every day just to keep myself moving.
And you're now only 2 weeks from surgery.
2 weeks, yeah.
So tell us how you're getting on now.
I went back to the gym yesterday for the first day. I'd done 80-90 minutes worth of cardiovascular work. I'm not doing any running yet, that's still a bit uncomfortable. I'm obviously not doing any weightlifting or anything stupid like that, but the cardiovascular work was good. It didn't hurt. I've been off my pain medication for 10 days now. I'm just amazed with the progress I've made.
How much pain do you have in your back?
Very little. If I sit down for too long, if I sit down for more than, say, 20-30 minutes, when I stand up, I get a small burning sensation. But that goes within 2 or 3 seconds, and I'm fine. I honestly don't know. Apart from feeling the scar with my fingers, I wouldn't have known that I've had an operation. I absolutely feel amazing.
And do you think that your preoperative pain's gone? Does your back feel more stable?
Yes, definitely, without a shadow of a doubt.
Thank you.